Greetings. Welcome to Brainetainment, the channel that demystifies intricate medical and scientific concepts. Our mission is to make learning enjoyable and accessible to all, as we unravel the mysteries of the universe, one topic at a time. From the smallest microorganism to the vast cosmos, we cover it all. Don't miss out on our enlightening content. Do hit the subscribe button. Today we're going to delve into an intriguing medical procedure known as fecal matter transplants. A fecal matter transplants, or FMT, may sound off-putting, but it's a fascinating and potentially life-saving procedure. Let's dive into what this procedure is all about. Picture your gut as a thriving, bustling city, teeming with diverse populations of bacteria, yeasts, and other microorganisms. This is your gut microbiota, and it plays a crucial role in your overall health, from digestion to immunity. But what happens when this city suffers a disaster and its population gets out of balance? Certain harmful bacteria can overrun the gut, leading to severe illnesses. Here's where fecal matter transplants come in as an unexpected hero. Fecal matter transplants involve taking carefully screened and prepared fecal matter or stool from a healthy donor and introducing it into the gut of a sick patient. Yes, it might not be the most glamorous of procedures, but the aim is simple: to restore the balance of the gut microbiota. So, how is this procedure done? The donor stool is first tested rigorously for diseases and harmful bacteria. Once it passes these checks, it's mixed with a saline solution, strained, and then placed into the patient. This can be done through various routes like a colonoscopy, nasoenteric tube, or even swallowed capsules. This procedure isn't as new as you might think. The concept of fecal matter transplants has been around for centuries, with the earliest documented use in 4th century China. However, it's only in recent years that modern medicine has begun to fully appreciate the potential of FMT, particularly in treating conditions like Clostridium difficile infection, a severe and potentially life-threatening gut infection. So while the idea of fecal matter transplants might initially make you squirm, it's important to remember that this procedure can be a game changer for those suffering from serious gut imbalances. It's a testament to the incredible complexity of our bodies and the crucial role our gut microbiota plays in our health. So, that's the basic concept of fecal matter transplants, but why would anyone need such a procedure? The human gut is a complex ecosystem, and sometimes it can get out of balance. This balance, my friends, is largely maintained by a community of microorganisms known as gut bacteria. These tiny yet significant residents of our digestive system play a pivotal role in our overall health. They aid in digestion, support the immune system, and even influence our moods. However, certain conditions or treatments can disrupt this microbial harmony. For instance, prolonged use of antibiotics can wipe out beneficial bacteria, leaving the gut vulnerable to harmful invasive species. Similarly, certain illnesses such as Clostridium difficile infection, inflammatory bowel disease, or irritable bowel syndrome can cause a significant imbalance in our gut flora. So, how can we restore this balance? Well, that's where fecal matter transplants, or FMTs, come into the picture. As odd as it may sound, FMT involves transferring fecal matter from a healthy donor into the gut of a recipient. The idea is to reintroduce beneficial bacteria and other microbes to help re-establish a healthy gut microbiome. FMTs are not just a whimsical idea. They're backed by science and have shown promising results in treating a range of gut-related conditions. For instance, in the case of recurrent C. difficile infections, which are notoriously difficult to treat, FMTs have shown success rates of up to 90%. That's quite impressive, isn't it? Moreover, researchers are exploring the potential of FMTs in treating other conditions such as obesity, mental health disorders, and even autoimmune diseases, all of which have been linked to imbalances in gut bacteria. In essence, fecal matter transplants offer a unique and promising approach to restore the balance of our gut microbiome, potentially helping us combat a variety of health conditions. Now that we know why FMT is needed, let's explore how effective it really is. Despite its unusual nature, fecal matter transplants have shown promising results in clinical trials. Now, before you cringe at the thought, let's delve into the facts and figures that support this rather unconventional medical procedure. The primary condition treated with fecal matter transplants, also known as FMT, is Clostridioides difficile infection. This nasty bacterium can cause severe diarrhea and inflammation of the colon. often recurring despite standard antibiotic treatment. Research has shown that FMT can resolve symptoms in up to 90% of these difficult cases. Just imagine, a simple transfer of healthy gut bacteria can help regain balance and fight off this stubborn infection. But the wonders of FMT don't stop there. There's growing evidence that it could be beneficial in treating other conditions linked to gut microbiota. These include inflammatory bowel disease, irritable bowel syndrome, and even certain metabolic and neurological disorders. While more research is needed, the potential of FMT is certainly intriguing. Take ulcerative colitis, for instance, a chronic inflammatory bowel disease. A study conducted in 2017 found that nearly a quarter of patients achieved remission after FMT, compared to just 5% who received a placebo. That's a significant difference, isn't it? Now, it's important to note that FMT is not a magic cure-all. It's a tool in the medical toolkit. And like any tool, it needs to be used judiciously and under the right circumstances. The donor's stool must be carefully screened for infections and diseases, and the procedure itself should be performed by trained medical professionals. The world of FMT is still largely uncharted territory, and there's much we don't yet understand about our gut microbiome. But the results so far are promising, and the potential benefits of FMT could be vast, transforming the way we approach a variety of health conditions. Of course, like any medical procedure, FMT is not without its risks and challenges. While fecal matter transplants can be a game changer for some, it's important to consider its potential risks and challenges. Fecal matter transplants, or FMTs, are not without their potential pitfalls. One of the major concerns is the risk of infection. Since the procedure involves transferring fecal matter from a healthy donor to a patient, there's a chance that harmful pathogens could be transferred as well. Patients may experience adverse reactions too. These reactions can range from mild discomfort to severe side effects, including bloating, diarrhea, constipation, or abdominal pain. In rare cases, there have been reports of serious infections and even death. Another significant challenge is regulating and standardizing the procedure. As with any medical procedure, consistency and quality control are crucial. But when it comes to FMTs, the raw material, human feces, is inherently variable. Donors are different, their diets are different, and their gut microbiomes are different. This makes it difficult to ensure that every FMT is the same and will yield the same results. Moreover, there's the question of how to categorize FMTs. Are they a drug, a tissue, or something else altogether? This ambiguity makes it hard to apply existing regulations, and new ones may need to be developed. There's also the challenge of public perception. Let's face it, feces isn't exactly a popular topic of conversation. Many people find the idea of FMTs off-putting or even repulsive, which could hinder the acceptance and widespread use of this potentially life-saving procedure. Lastly, there's the issue of accessibility. At present, FMTs are primarily used to treat recurrent Clostridium difficile infections, a relatively rare condition. If the use of FMTs expands to include other conditions, will the supply of healthy donors be able to meet the demand? Despite these challenges, the potential of fecal matter transplants is undeniable. As we continue to learn more about the human microbiome, we may find that FMTs hold the key to treating a wide range of conditions. But as with any medical breakthrough, it's crucial to proceed with caution, acknowledging the risks as well as the rewards. So, there you have it, a simple, understandable explanation of fecal matter transplants. We've journeyed through the what, why, and how of this intriguing procedure. From understanding its basic concept, the transfer of healthy fecal matter to treat a myriad of gut-related issues, to recognizing its crucial role in modern medicine, it's clear that fecal matter transplants are more than just a fascinating subject. We delved into the need for such a procedure, understanding that an imbalanced gut microbiome can lead to serious health complications. We also explored the effectiveness of fecal matter transplants, as numerous studies have shown promising results in treating various conditions, from Clostridium difficile infection to irritable bowel syndrome. However, like all medical procedures, fecal matter transplants are not without their risks and challenges. The potential for unknown pathogens, the non-standardization of the procedure, and the psychological barrier for patients and donors are all hurdles that need to be overcome. Looking ahead, the potential of fecal matter transplants is immense. As our understanding of the gut microbiome expands and technology advances, we may see this procedure becoming more commonplace, possibly even a routine part of preventative healthcare. Thank you for joining us on this fascinating journey. Don't forget to subscribe to Brainetainment for more intriguing insights into the world of science and medicine. Until next time, stay curious and keep learning.